Hi everyone, this is Vanessa from the Young Women's Advisory Council, and this is the YWAC end of cohort report for the 2025 to 2026 cohort. So to start, here's an overview of what it is we're going to cover today. We are first going to review the trainings that we did from July 15th of last year to October 21st of last year. These trainings were created to strengthen our leadership skills and provide education as well as prepare us to create programming around a critical issue. We will then cover the critical issue that we chose and the programming that we did around it, physical wellness. And to close out, we will review our cohort findings within a survey that we did so that we can better understand what next steps we can take to build off of what it is that we created in this cohort. So for the training highlights, one theme that definitely kept popping up was leadership. Our leadership and foundations training, especially that coupled with the Night of 100 Women, which many of our cohort members attended, shaped our understanding of what is expected from our cohort and how we can work to achieve that. Another big theme within our training was wellness and self-care. So specifically trainings from the 7 dimensions of wellness, as well as knowing your body, and other trainings as well provided education on, what prioritizing our personal well-being and that of our communities can and should look like. There were also trainings around the theme of impact and action, especially our public policy and civic engagement training, and that provided context and understanding for how we can advocate for, the safety and well-being of women in Indianapolis, given the political systems that shape our personal lived experiences. Our critical issue for this year's 2025 to 2026 YWAC cohort was physical wellness, and our selection ensures that women ages 18 to 24 have the skills to navigate healthcare, as well as prioritize nutrition/fitness and optimize health safety. And within this next part of the presentation, we're going to first talk about the events that we did. The first one we did was a guide to physical wellness, a focus group, and this was really geared towards getting a better understanding of what is it that women ages 18 to 24 are currently doing to prioritize their physical wellness, and how can we make sure that our programming supports that. Our second event was titled Run It Back for Her. It was a community wellness walk in honor of Women's History Month that was held in Broad Ripple Park. And then our third event was titled Take Back Your Power, a self-defense workshop. And in this workshop, we learned about a self-defense mindset and what that can look like. We learned about situational awareness as well as real-life defense techniques. We also had a lot of educational posts for Women's History Month, but also just throughout the cohort as a whole. So, for example, one of the posts that we did was about 7 women's advocacy organizations that folks may not be aware of and are based in Indy. Another was about 3 historical women that are from in Indianapolis. We also had a set of videos that showcase different Black women-owned businesses within Indy. And then we also, for April, this wasn't obviously for Women's History Month, which was in March, but it was Sexual Awareness Month, so we had a post about that as well. And moving on to the final section that we're going to cover today, it's going to be our cohort's findings. So we conducted a Hoosier Young Adult Health and Wellness Survey in order to obtain data surrounding the experiences of women ages 18 to 24 with regards to their physical wellness and healthcare. And so these were our findings. And within these findings, we're not going to talk about every single question just because that would take a while, but I just wanted to do the highlights essentially for this presentation. So one of the questions was, how long have you lived in Indianapolis? We see majority of folks have been here pretty much their whole lives. Another was around gender identity. We see, majority of the folks that took the survey were cisgender or female. In terms of sexual orientation, we see that majority of our participants were heterosexual, but of course there were still folks who were bisexual, pansexual, asexual, or just preferred not to say. In terms of total annual household income, that was pretty much spread more or less evenly throughout from, less than $20,000 to a year to $160,000 plus. And moving on to the meat of our results, we see that a lot of the folks who took this survey are, if they're seeing a healthcare provider, they're making sure that they're seeing, their primary care provider, their OB, their dentist, their eye doctor, sort of those routine checkups that we're encouraged to always get. Folks who answered are receiving that. But when it comes to their behavioral health, so therapy, counseling, psychiatry, etc., we see that attention within that realm seems to wane. And then when it comes to what is holding folks back from receiving the care that they need or want, we see that complexity is a big barrier. So booking appointments, filing insurance, taking time off of or getting off work to be able to book these appointments, which are oftentimes happening during the work week while folks are at work or at school, is a massive barrier. Another one is cost. Behind that is access. And then last is poor experiences / providers or other situations that were not mentioned. Moving on, when it comes to comfort with regards to asking a healthcare provider questions about, one's own body or reproductive health, we see that about 44% of our participants, so nearly half, feel neutral. Unfortunately, there was someone who was uncomfortable doing so. And then in terms of, on the other end, we had 2 folks, or 22%, who felt a bit more comfortable, and then another 2 folks who felt very comfortable doing so. All right, so this is a bit of a more difficult graph to break down. So we're just going to take a second here to take it in. So first, the full question is: sort the following based on the emphasis or time you place on health on a yearly basis. And the way the question was formulated was, it had all these different options. So physical fitness, nutrition, behavioral health, in a list. And then you could rank them 1 through 8, 1 being the highest, and then 8 being, what you prioritize least. So if we take, you see at the bottom, there's like a darkish blue associated with the number 1. If we look at the top of the graph and we see physical fitness, we see that there were 3 folks who categorized physical fitness as their number 1 priority. And then if we take, that bluish, that really dark box at the end, that's sort of violet, and we look at that same category, physical fitness, we see that 2 people categorize that as their 8th priority out of all the different options. So hopefully that provides a bit more context as to how this graph was formulated. But these are results, and you can take a second to look at them with that context of how to interpret the results. And then here's the second graph that we're going to look at with the same format. If you could, where would you want to spend more time or money? So you can take a second to pause the video to properly take in the results. But biggest takeaway here is that we see majority of folks have physical fitness quite high up in terms of what they would want to spend more money on or time in if they had the means to. So obviously, especially those last 2 graphs were a bit heavier. So we're just going to take some time to summarize our key takeaways from those findings. First off, we see that the biggest barrier is healthcare complexity. A lot of folks don't know how to, or don't have the time to really go through the bookings process or taking time off work in order to properly prioritize their healthcare. Cost was definitely a close second barrier. We also see that physical wellness, exists as routine checkups for most, but not as an everyday priority. So because of, the way in society we're encouraged to get our dental appointments in or, visit our primary care physician, folks are pretty good with, doing that based on these results. But when it comes to taking a look into therapy or working with a psychiatrist, prioritizing your mental health, that sort of takes a backseat for a lot of folks. We also see that nearly half of our participants feel only neutral asking healthcare providers, questions about themselves and their bodies. And this is obviously with regards to women. And so, of course, that's something that we need to be aware of. And then finally, we see that, there's a lot of focus on fitness and nutrition, and there's a lot of folks who want to spend more time prioritizing that. But we also see that there's more support needed within mental and preventative care as well. So overall, we see that folks are engaged within their health, right? Women want to prioritize their wealth, and we're taking steps to do that, young women ages 18 to 24. But there is still a lack of support navigating and accessing healthcare and our physical wellness as a whole in its entirety. And so that's definitely something that we need to work on. And something that future cohorts within YWAC can build off of when it comes to creating more programming, more events, etc., to help educate and support women our age when it comes to prioritizing our wellness. So thank you so much for taking some time to sit down and listen to what it was that we were able to accomplish in this small but mighty YWAC cohort of 2025 to 2026.